Maury, we'll get started. Um, I'll recognize a quorum. Chris Hahn, Margot Garant, Mike Smith, Father Alex, and Frank Trotter, and myself. Is our GSO rep, Julia Brown, on the call?
She is not yet.
Okay, and I see Linda Arman has just joined us.
Hello.
Hi, Linda.
Good morning.
All right. And you got a yes from Errol, but he's not on?
Correct.
All right, maybe he'll join us.
Yeah. Both Errol and Julia had said they can be here. So.
All right, well, we have a quorum, so we'll get started. Good morning, everybody. Good to see you again, at least on Zoom. We were hoping to have this meeting in person since, we have most of the students back on campus and stuff, but this, just still too much going on between the Delta variant, all the challenges that Stony Brook is facing with dealing with that, which we'll hear more from Maury. And we just thought it would be prudent to continue to do this on Zoom. I know Linda and Chris love that anyway. Maybe in December, we'll be able to do a meeting in person. So we will call to order the meeting. And first item is the approval of the minutes. The meeting of May 3rd, 2021. I'll move them. Chris Hahn seconds them. Are there any comments, revisions, or additions? Any abstentions or no votes? The minutes are approved. Chair's report. I was going to welcome Errol and Julia, but if they're not on.
Errol is here.
Hey, where's Errol? Errol, good morning, Errol.
Good morning, Kev.
Hey, so for those who don't know, Errol is one of our newest members of the council appointed by the governor. And I have known Errol for more than 10 years. We're very fortunate to have him. He's currently the sheriff of Suffolk County, which covers the entire county from Huntington to Montauk. Unlike the Suffolk County Police Department, which just covers the 5 West End towns, Errol's jurisdiction is the entire county. He's a terrific guy. If you looked up the word gentleman in the dictionary, a picture of Errol would be there. He's a great guy. We're very lucky to have him. And if we all meet together in person for the December meeting, you'll all get a chance to meet him. So welcome aboard, Errol.
Thank you, Kevin.
And Julia is still not with us. Julia Brown
Correct.
is our new GSO representative, and maybe she'll be joining us shortly. Chair's report, I just have 2 things to mention. As you know, just a couple of changes in Albany lately, and very excited to have Governor Kathy Hochul, take the reins of our state. Worked with her for the last 7 years on the regional economic development councils. She's just terrific in so many ways, and she's always been a big fan of SUNY, which is great. I met with her about a month ago and reinforced how important Stony Brook is to the Long Island economy as well. And what's great is she totally gets it because she comes from Buffalo and she realizes how important SUNY Buffalo is to the western part of the state. And she understands how important Stony Brook is to the downstate region. So that's, I think it's going to bode well for us. So excited to have her leadership in Albany, and hopefully it'll mean good things for Stony Brook. The only other thing I wanted to share is, I briefed you guys in the past. I participate in the ACT, the Association of College Trustees. We meet regularly, like in October. So we have a Zoom meeting coming up in a couple of weeks. But early this year, they formed a committee. It's chaired by the chair of either the Oneonta Council or the Cortland Council. I think it's Oneonta. And there's about 6 of us on it. And we met with the chancellor over the summer, Jim Malatras, and the purpose of the group is to come up with recommendations as to how to make the councils better, maybe more effective. And so if any of you have any ideas, you want to give me a call or shoot me an email, I'd be happy to share those ideas with the working group and then we'll present it to the whole ACT and of course, share it with the chancellor. But if you have any ideas or suggestions on how we can make the councils better, more efficient, more productive, more effective, let me know. And with that, that ends my chair's report. Very happy now to hand it over to President Maureen McGinnis for her report.
Well, good morning, everyone. So glad to have all of you with us. And I too look forward to being able to do this in person soon. As many of you know, I've now been in as president a little over a year. And one of the most important things I've needed to do is continue to build my leadership team. We still have a couple more vacancies to go, but I'm just enormously thrilled with the number of great new people who have joined Stony Brook University. They are strategic in focus. They understand not only what we need to do strategically, but tactically in order to implement the vision. And they are working hard every day to move us forward. So let me introduce to you a couple new team members who've recently joined us. The first is Justin Fincher, who is our new VP for Advancement and the Executive Director of the Stony Brook Foundation. And the second is Bill Warren, our new Vice President of Marketing and Communications. Let me tell you a little bit about each of them. So Justin served as the Vice President for Advancement at The Ohio State University. There he was responsible for strategy, operation, and resources to effectively mobilize what were multi-billion-dollar campaigns, and they engaged hundreds of thousands of Ohio State alumni and donors in order to develop the philanthropic support for that institution's mission and goals. Bill spent the last decade at the University of Utah, where he was the university's first Chief Marketing and Communications Officer. Here, he will lead all marketing and communications for the academic and research enterprise, Stony Brook Medicine, and Stony Brook Medicine healthcare system. In addition to his work at Utah, Bill brings many years deep experience in New York companies and in New York City government. So we're thrilled to be able to welcome him back to New York after his sojourn in the Southwest. Starting next week, will be our new Executive Vice President for Health Sciences. That is Dr. Hal Paz. Hal has a vision of growth for Stony Brook Medicine that integrates our clinical, educational, research, and service missions. This is really a moment of significant transformation in the healthcare industry. And his experience, I know, will enhance our position as a world-class leader in research and innovation. And I'm hopeful that he'll be able to join us at our next Stony Brook Council meeting. There is no doubt that all of us in leadership positions throughout the institution have been stressed to the limit this year with COVID, a new president, new directions, budget limitations, vaccine mandates, and some really significant weather-related issues. But I cannot tell you what a really great group of individuals we have working at Stony Brook. They are strong, creative, thoughtful. They work well together as a team and have done extraordinary things for this institution over the last 18 months. And I couldn't be prouder to be a part of this team. So let me tell you some of the things that have happened since we last met. You may not be aware, but we had some really significant storm damage to our campus. It wasn't the hurricane, as many of us were worried about. It was instead the remnants of what had been Hurricane Ida that rolled through kind of a week after Hurricane Henri, and the really significant amount of water that dumped on this campus in a very brief period of time resulted in the flooding of several of our buildings, most significantly 2 dorms that had about 7 feet of water in their basement, which pretty much ruined all electrical and fire and safety systems, meaning that those 2 dorms are currently offline. We had to relocate nearly 400 residents to elsewhere on the campus. for at least this semester and probably into next semester as well. Part of our brand new union building also received significant damage, as well as the Wong Center. So we've been working closely with state, county, and federal agencies, not only to get those fixed, but hopefully to be able to recover some reimbursement for those costs. As you know, there is a state mandate for our students to be vaccinated, and we have a highly vaccinated campus. And as the deadline for our students to be vaccinated essentially comes due today, we are working with our last number of students who either have not given us their proof or who are not vaccinated. And we are certainly hoping that that number gets to zero, but we are continuing to work with them. We have a mask mandate inside all of our buildings. And we are doing surveillance testing throughout our campus community. And I can tell you that we have extraordinarily low positivity rates, even with surveillance testing. And I can tell you that probably the safest place to be in all of Suffolk County is right on our campus. We recently held an in-person commencement for our class of 2020 graduates who were not able to graduate in person in May of 2020. It was well attended. It was a joyful celebration for the graduates, their families, and for SBU faculty and staff. This fall has, it's not normal, but it certainly feels a lot more like a normal year than last year did. Our students moved in starting mid-August. We brought our first year class in a week before classes started so that we could have an extensive series of orientation, programming, get to know you campus and all that great stuff. Our students are so excited to be back on campus. They're compliant with our rules, and they're really having a pretty normal semester. There is no doubt that there is resistance to the vaccine mandate, both among our students and some of our employees, and I'll talk about the potential impact on our hospital in a few minutes when I get to that segment. We still have a few hundred students from whom we have not heard about their vaccination status, and we are one by one working through with them. The state rules are essentially that if they are not vaccinated and if they do not have either a medical or religious exemption, that we will have to disenroll them. So we don't yet know what that number is, but boy, am I hoping that that number gets to zero. That is certainly our goal as we talk with and work with each student one by one. Fall normally is kind of ranking season in higher education. Let me tell you some of the key ones that have come through recently. Stony Brook University was ranked 7th out of 300 employers overall and the top higher education institution in the Forbes annual ranking of America's best employers for women. And we also made Forbes list for best employers for diversity. Those are both two things we're very proud of as we work hard on this campus to have an inclusive environment where all of our employees can thrive. We rose significantly in Forbes 2021 America's Top Colleges rankings. We jumped 114 places and 26 places among public universities. So that makes us 62nd overall in the US and 23rd among public universities. It's actually not that anything really significantly has changed at Stony Brook. It is instead that Forbes really rethought what are the things we should be looking at in order to determine America's best universities. How should we be evaluating the country's top schools? And they decided that they were going to care a lot more about the mission, some of the mission critical things that we think are important. And that is that we make education accessible to a great diversity of talent, including students from lower socioeconomic income, as well as making sure that those students go on to be successful, not only in graduation, but afterwards, after they graduate. And this change in their metrics mean that in the top 25 spots, there are 6 public universities, and that's a really dramatic change. In the probably best known ranking system, US News and World Report, we ranked 93rd overall and 38th among public universities. And that's similar to where we've been in previous years. Let me tell you a little bit about a really important strategic opportunity that we are pursuing, and you're going to hear a little bit more about that later. And that is that we are working to craft a proposal to develop an application to be the anchor institution on Governor's Island, as the City of New York and the Trust for Governor's Island are looking for an anchor institution to turn Governor's Island into a site of climate science development for the island. It's a really exciting project that could be a total game changer for Stony Brook if we are selected. And even if we do not, it has energized our faculty across our disciplines to think about how do we come together across disciplinary areas in order to work on really many of the big challenges facing us, not only in understanding climate science, which we have been doing for many, many years, but to develop solutions and impact public policy in the years coming forward. And a little bit later today, both Rose Martinelli and Paul Gobart are going to give you some of the highlights of our proposal. I'd like to turn now and tell you a little bit about what is going on in Stony Brook medicine. Carol Gomes is not able to join us this morning, in large part because today is the last day before the governor's mandate that all hospital employees be vaccinated goes into effect, and there's a lot of detail to be working on with that. The hospital census.
Yeah, it could be that they didn't get updated into the broadcast mail.
Actually, anybody who's not muted, will you? Thank you. The hospital has been at record high census levels in the emergency department and in the hospital for the last couple of months. That has nothing really to do with COVID, but instead with non-COVID patients. And you know, what's the explanation? It's most likely that there were a number of things that people did not tend to in 2020 that have suddenly become things that bring them to the emergency department and to the hospital. We've been running for over a month now at a pretty steady census of about 50 COVID patients. And just to give you a sense, last winter, January, February, March, we were really running more at about 125, 130 patients in the hospital at any one time who were in for COVID-19. So this is a significantly lower rate, and it's been steady for a little bit over a month. Stony Brook University Hospital, Stony Brook Eastern Long Island Hospital, and Stony Brook Southampton Hospital have all been working really hard, really employee by employee, to address the vaccine mandate that was directed by New York State Department of Health that required all hospital staff and faculty to obtain their first dose of vaccine by 5 p.m. today. Our vaccination rates continue to improve at this point, kind of hour by hour. And we are, nearing sort of 90% or more at each of our hospital locations. Our unvaccinated staff have been informed that they are removed of the schedule as of tomorrow. We running vaccine pods every day, including today, and we certainly hope of the remaining employees who are not vaccinated that more and more of them will choose to do so today. There is no doubt this causes staffing complexity at a time when the entire healthcare industry is facing a staffing shortage. we will meet this predominantly through really aggressive recruiting efforts, through being able to make overtime and temporary agency staffing available. There are some really recent changes that make a big difference in helping us respond to this. Both the SUNY Chancellor and the Governor's Office approved 2.5%, two and a half times essentially overtime rates for key titles that will be most severely impacted by the vaccination mandate, so that we can ensure smooth hospital operations. In addition, we were able to enhance our nursing annual salary compensation package based on geographic factors, and that too was approved by the SUNY Chancellor and the Governor's Office and announced last week. And that certainly helps us retain our great talent who have been working for us previously. We've had big and successful job fairs. We will continue doing those. As I said, we'll use overtime, agency personnel, and per diems to help us get through the challenges that the vaccine mandate poses. We've been working for weeks on these contingency plans. We have them executed for every department, every service line across the hospital, and it will mean minimal disruption to all of our elective and surgical procedures. And we are, they are daily meeting in order to gauge our staffing needs and to adjust as they are presented. Let me tell you about some great things or new milestones or new programs, things that have been happening in Stony Brook Medicine. In September, we opened a new cardiac catheterization lab. It has state-of-the-art equipment. We've also opened 2 outpatient endoscopy suites in the ambulatory care pavilion, and all of this to accommodate growing patient care needs. Stony Brook Children's Hospital celebrated its 10th anniversary, which is really exciting. And of course, more than 40 years in taking care of kids. Stony Brook University Hospital recently launched a physician communication training compassionate connected care pilot. We're a national beta site for this pilot. We're partnering with Dr. Michael Bennick from Yale Medicine and Mary Jo Assey from Press Ganey, and 15 physicians from our emergency department and inpatient patient experience teams are participating as part of this. Let's talk about ratings and community engagement. So for our cardiothoracic surgery division at Stony Brook Heart Institute, they've earned a distinguished 3-star rating from the Society of Thoracic Surgeons for its patient care and outcomes in isolated coronary artery bypass grafting procedures in 2020. This 3-star rating denotes the highest category of quality, and it places us among the elite for heart bypass surgery in the US and Canada. Stony Brook University Hospital also received a 2-year advanced inpatient diabetes certificate from the Joint Commission after a comprehensive review of its diabetes program. We're the 7th hospital in New York State, but the first hospital in Suffolk County to achieve this advanced certification, and there are only 66 nationally that have this. Stony Brook Medicine administered the first LBGTQ+ community health needs assessment survey on Long Island. This survey is a landmark study seeking vital data that will shape the future of LBGTQ+ healthcare in Nassau and Suffolk County. It represents collaborative efforts of Stony Brook Medicine in partnership with more than 20 Long Island-based organizations and community leaders, all of whom reach out to sectors of the LBGTQ community, and we work on advocacy programming and services. You might have seen a press release recently of our letter of intent with Catholic Health, which is a large integrated system that has more than 17,000 plus employees, 6 acute care hospitals, and a thriving network of physician practices. This is part of our larger clinically integrated network strategy. It's going to allow Stony Brook University Hospital to compete with other hospital systems in our market. It will improve patient care, offer new services, and give us enhanced medical education sites for our students and residents and really support both systems. So we're excited about that. We will be aligning trauma services, population health initiatives, pediatric capabilities, clinical service lines, and training opportunities. Also, as part of our formation of the clinically integrated network, Stony Brook Medicine entered the Medicare Shared Savings Program in 2020. This requires the development of a network of providers and hospitals that provide coordinated care to patients with the goal of improving quality and limiting unnecessary spending. And as part of that, I'm delighted to say that in our first year, we earned more than $4 million in shared savings. This is really a tremendous accomplishment, not only because we did so in the middle of the pandemic, but because most other health systems do not see such shared savings in the first year. And this makes a big difference in our bottom line and into the care that we're providing our patients. Another significant development is that we've signed a 30-year lease on the former Sears Building in Lake Grove for a 250,000 square foot multi-specialty office building that will allow for the expansion of our outpatient presence in our core market. Initial occupancy is anticipated for late spring 2022, and that's pretty exciting. We've also entered into an agreement to be the provider at Peconic Landing in Greenport and look forward to groundbreaking for a larger medical office on their campus in September, on September 30th, so next week or later this week, I think it is. We're preparing to continue administer boosters to essential workers as it will be defined by the CDC and to other eligible employees, other eligible individuals as part of the guidance as it continues to move and change from the CDC. We've also made considerable progress in our post-acute care collaborative, working to design seamless transition of care from inpatient to rehabilitation or skilled nursing facility settings. This is an essential part of our success with our Medicaid, Medicare partners, and also helps with financial rewards for the hospital as we manage these relationships going forward. So I think that's all I have to report on, and I'm happy to take questions.
Are you sure that's it? Because that was.
I think that's it.
That was a lot.
Yep, we've been busy.
Yes, I could tell. Well, great report, Maury. I'm going to have some comments and a question. I'm sure the others will too, but I just want to mention two people I forgot to mention in the beginning when I opened up. Ahmad Balazi, the president of the Alumni Association, is with us, and we appreciate everything that you do, Ahmad. And Manjot Singh, the undergraduate student member, I believe, is with us too. So thanks for joining us. Maury, that was a great report. For the other council members, I had the pleasure of joining Maury and the chancellor at the Stony Brook Union ribbon cutting ceremony at the end of August. And the kids were back on campus, and it was actually so exciting because the campus has basically been a ghost town for the past year and a half. And it was a beautiful day. It was, the kids were all over the campus. It was great to see them, faculty and staff as well. But I said this to Maury, but Maury was beaming, and it was so great. And I didn't really realize it or appreciate it at the time, but, we hired her in the middle of COVID, and she accepted in the middle of March, just as the governor was shutting down, the state. And her whole first year was basically a remote experience. And to see her on our beautiful campus with thousands of students and faculty and staff all around, it was great. And you seemed really happy, Maury, and I was happy for you because all the things we pitched to you when we were recruiting you and hiring you, I felt like you were actually seeing firsthand finally. And so the official welcome again, as things are beginning to get back to normal. And for the other council members, you got to see this new building. It also unfortunately took a hit with the storm. The so-called remnants of Ida, devastated the dorms and part of the union. But we're going to try to have a future council meeting in the new student union because it's a beautiful building. And I could speak firsthand because when I was going to Stony Brook in the 1980s, the building was a dump. It was a dump then. It was a dump for the next 30 years. And it's just gorgeous now, and will really be such a huge plus for the students in so many ways. And Rick Cato and his team, they have so many different plans and so many different clubs, and getting the students engaged, it'll really be a terrific building, to do that. And so hopefully we'll have maybe even a December council meeting there. And so can't wait for you guys to see it. Maury, congratulations on the great team that you continue to build. I always love it when we get talent from Big Ten type schools. Linda Arman has the affinity for Ohio State with both her sons going there, and to get two top people from Ohio State to join the team, and Bill from Utah, it's great. And all the things you just mentioned in the health science center aspect of your report. Bill, you could spend your whole first year just promoting and doing media on tooting the horn for Stony Brook on all those things that Maury just mentioned in her report. So welcome along, welcome to Bill. And I had the pleasure of doing a Zoom with Justin, I think last week or 2 weeks ago. So welcome, Justin, and look forward to meeting Hal. And that leads to my first question, Maury. Who's the dean of the medical school now, and does Hal act as dean of the medical school too, or will he be looking for a new dean of the medical school?
He'll be looking for a new dean of the medical school. The current dean, who's in an interim position, is Dr. Bill Wertheim,
Right.
who's been on our faculty for many years.
Yes.
And one of the things that I did was split the role. Dr. Ken Koshansky held the dual role as both vice president of the health system and dean of the School of Medicine. There's no perfect structure. There is the right structure for now. And I believed that what we needed was to split the role. If you look across academic medical centers, about 50% do it joint and about 50% do it split. So after Dr. Paz joins us, one of the things we'll do is begin to launch a search for the next dean of the Renaissance School of Medicine.
Oh, that's great. Yeah, that's great to hear. Yeah, and Bill Wertheim has done a great job as the interim and acting. So thanks, Bill.
Absolutely.
For that, and good luck with Hal. We'll look forward to meeting him, and all the other things you mentioned. Again, the affiliation with Catholic Health, taking over the Sears Building, doing relationships with Peconic Landing. Again, those are home runs, and we should really be, singing from the rooftops on that and letting all Long Islanders know that, because there's that other small little hospital system on Long Island that, we sort of compete with them, whether people like it or not. There's competition in the health services system. And there are only 3 systems out here on Long Island, the Northwell, the Catholics, and Stony Brook. And so to have an affiliation with the Catholics, I think is a good idea, and will bring good things, to the university. So congratulations on that too. Other council members, comments or questions for Maury, starting with Linda.
Hi. Well, being a part of the search committee, I want to say that I think we hit a home run here. So thank you. With our president, we really wanted dynamic leadership, and I feel we got it. So thank you. Welcome to all the new folks. My question for you is on the nursing shortage that's going to happen tomorrow. Are we looking at a strategy to bring people in from other areas? Because, it's just going to be like a great nurse shuffle, I feel like, between the New York health system, because everybody has the mandate. Are we going to be recruiting from outside of the area where there are not mandates, and people might want to take advantage of coming to New York, or although the cost of living, but is there, what's the plan?
Well, we've been looking at any and all options. I will say that what we are facing, while New York is the very first state to enact the vaccine mandate. You might have heard that President Biden
Yes.
has also added a mandate. It just hasn't taken effect yet
Right.
for every institution in health that receives Medicare and Medicaid dollars. That's virtually the whole nation, right? So while we are aggressively recruiting and certainly looking at all options, it's not like there's an excess of nursing capacity really anywhere else. So, you know, we're working and responding, and we are also working with each and every employee, and we really hope that we will lose very few. But it's probably inevitable that there will be some who choose not to get vaccinated.
Okay.
And it's not just nurses. I mean, this applies to any and all employees. So when we're looking at numbers, you're not necessarily looking at the number of nurses.
Okay.
This is really any personnel who are in the healthcare space. The vaccine mandate applies to them.
Okay, great. Thank you.
Any other council members have questions for Maury?
Yeah, Frank.
Hey, Frank.
Maury, first, thank you so much for updating us with all of the many things that are going on. I appreciate that. I'm very excited about Catholic Health Affiliation, and I'd like to hear a little bit more about it because I'm not exactly sure how it's going to work, even though you did describe it, especially coming from the South Shore where NYU Langone is going to be planting itself at Brookhaven or Long Island Community Hospital. So if you could elaborate on that, I'd appreciate that. And
I'm happy to.
Does that involve any name change or affiliation on signage or any of those kind of things, or no?
No, it won't be that. I mean, it's important to understand that in many ways, we serve and have different strengths, right? So we're the academic medical center that you come to when you need really complex care, tertiary and quaternary care. And they are hospitals that are serving less acute patients. And so there are a number of things that we can do for one another that are very complementary. So a great example is they can use more of our specialty care, particularly around trauma issues. And so in a couple of their hospitals, we'll help to provide more specialized care that up the level of trauma care that they can provide to patients. Meanwhile, at some point in your progression of acuity of care, you no longer need to be at Stony Brook University Hospital, but still need to be in an inpatient setting. And so you may get transferred to one of the Catholic hospitals. We also need more training sites for our students, and it's great for them to have students and residents in the hospitals. So we look at those places where we can support one another because of the different mission that each of these different healthcare sites serve. And we're working on this partnership around these particular areas.
Okay, thank you. Also, with regard to the Sears Building, will that be kind of like the COMAC centers?
Similar, yes.
Okay, very good.
Yep, lots of different specialties all in one place. It allows us to provide better patient care, and that quite often as a patient, you might need to see several different specialty areas in one given day and get imaging and get blood work and all those kinds of things. So that'll all be under one roof, but it also allows us to operate more efficiently in that we can have sort of a pool of staff supporting our patients instead of needing it in individual locations.
Thank you very much.
Margot?
Good morning. Thank you, Kevin. Maury, I'm just amazed by your information, your delivery, and everything that you have going on. It's just unbelievable what you're doing there for the campus and the community. I was really interested to hear more about the offshore wind energy collaborations that you're doing with many of your departments. And if we don't win this competition for Governor's Island, is there any further thought of having an accredited program for clean energy, climate change with the initiative that you did here?
Yeah, so thank you for that. I mean, obviously, climate change and solutions to support our very ambitious goals in New York State and hopefully more broadly in the US are things that our faculty have been working on for many years. Coming together across our many disciplines in the Governor's Island proposal, which you'll hear more about in a few minutes, has really energized our faculty. And we're thinking in a lot of different ways. And I think Paul Goldbart is on the line with us. Is there anything in particular that are around curricular initiatives that might be bubbling up that you'd like to address?
Thanks, Mari. Yes, there are. And in fact, there was a new program just this summer launched on offshore wind through the School of Professional Development to help begin developing a workforce. And there are many other initiatives that are emerging as we develop ideas around Governor's Island. And I think, as the president alluded to, even if it turns out that we're unsuccessful with the Governor's Island venture, I'm sure that many of these other ideas will stick, and we'll really run vigorously with them, because we've learned during this process what I think we already knew, that there is a tremendous enthusiasm both on campus and among many of our partners. So very exciting time to emerge in this field beyond what we're already doing.
Good, thank you.
Anybody else? Okay, well, again, thank you, Maury. And as Maury mentioned, she incorporated the Stony Brook Medicine item in the agenda because Carol's busy with the pre-craziness of what may happen with the vaccine mandate later on. So that then brings us to the next item on the agenda. Somebody who I've gotten to know and have been working with a little bit over the last couple of weeks, Rose Martinelli and Paul Goldbart, our new provost, on the Governor's Island proposal in more detail. Paul and Rose, take it away.
Great. Thanks very much, Kevin. And thanks very much, everybody. I think Rose and I will, if it's okay with you, Rose, tag team a little bit. As we discussed yesterday, I'll begin, but of course, Rose, chime in at any stage and especially at the end with comments and questions. So let me begin by saying, what's the opportunity? So 3 months ago, in fact, 3 months ago, just tomorrow, so June 28th, 2021, New York City and the Trust for Governor's Island issued an RFEI, a request for expressions of interest, trying to find the right partner to serve as the anchor institution for a climate science-related development project on Governor's Island, and to assist New York City in becoming the international hub for convening climate science research and solutions. And I'd like to explain a little bit more about what we think that means and what we're doing together to put forward what I think is an absolutely outstanding team. The president alluded to this earlier, but I want to reinforce it. It's been really magnificent to see the Stony Brook community coalesce creatively, constructively around this challenge. I think we all agree that we have a great shot to be invited for this role. But whatever comes of our effort, I think we're a much stronger university for it. We've learned a great deal, and there'll be many things to run vigorously forward with, regardless of the outcome. I want to spend a minute to put Rose on the spot here and say thank you enormously, Rose. Rose, as you all know, is Vice President for Strategic Initiatives. Rose has worked tirelessly, brilliantly over the past 3 months to build a team, work with the team, bring the best out of us, and has put in an enormous amount of really serious thought, as have many, many other people. So I think we all owe Rose an enormous thanks for everything that she's done. Let me ask you to put Governor's Island to one side just for a minute and think about Silicon Valley. No one can overestimate its impact on the region in Northern California, and of course, through the growth of the whole Silicon Valley enterprise, the entire world. And that's going to roll on for 100 years and more. And the question I think we have is, could we spark a similarly transformative development for New York State and for the world by focusing on the science, the engineering, and the solutions to the problems we face from climate change. And we see them, we feel them every day. We saw them with the recent very serious events that took place on campus through flooding, but also recently in Louisiana and elsewhere. What used to be perhaps annual or 5-year events are now cropping up with considerable frequency due to the increased volatility that climate change is bringing us. So what do we think about when we think about Silicon Valley? I'm sure we all have our own views, but I think I find myself thinking about creative innovation that identifies possibilities for new products and develops prototypes. But it goes beyond innovation. It involves bold entrepreneurship that matches creators and investors together to help move forward. And then comes in successful commercialization that actually takes those ideas and takes those products all the way through implementation so they really change the world. And so we find ourselves asking the following questions. Could we trigger a vibrant ecosystem of this type focused on climate solutions for the world? Could we spur the development of a really expansive new economy for the state of New York that are rooted in this question of climate solutions? And can we be key agents to develop the workforce needed to really power that new economy? In fact, we have strength in many of the pieces, and we have or are building relationships that will contribute further pieces and reinforcements. We have quite a lot of what's needed already in place. So what's our vision? Coming back to Governor's Island, put simply, it's to be the anchor institution, and as such, to create what we like to call the New York Climate Exchange, fueled by Stony Brook University, to try and accomplish these goals. So we have 3 interdisciplinary research and education themes that are really central to coastal and urban environments in the whole New York City area, including Long Island, but also the general region. They really are coastal urban environments that are under threat from climate change. So the initial 3 key factors that or key themes that we wish to focus on are the water, energy, food nexus. This is essential for public health. It's essential for food, for energy, for ecosystems and commerce, especially in areas like ours. The second of the 3 initial themes is equality and justice. Climate solutions have to be equitable, and we're bearing fully in mind the fact that climate challenges are already disparately harming socioeconomically disadvantaged groups. And the third is sustainable urban environments. It's vital that urban planning and urban development be done in ways that limit environmental impact and promote healthy, sustainable cities. So how are we going to take on these 3 themes? Well, we have a suite of activities planned in these areas. There's educational programming, there's programming for the public, and there's a research programming. And I'll just touch upon these 3 areas: education, programming for the public, and research. So on the education front, there'll be experiences for K through 12 students. There'll be programs for science teachers for grades 7 through 12. There'll be internships for students, and then we hope there'll be a semester at Governor's Island program to bring undergraduates to spend and learn, actually engaging with the activities on Governor's Island. Turning to the public and for decision makers, there'll be the Climate Exchange Forum. That's a key convening function that I'm going to come back to. There'll be a living learning laboratory experiences for visitors, as well as various workforce training programs. And as for climate solutions research, there'll be a research and technology accelerator program that aims to take ideas and move them further along the continuum from basic research to implementation, along with a climate exchange fellows program. The idea there is to bring the brightest minds to the work and to the promotion of awareness of the most promising ideas. So putting things together, what we have in mind is a function in which we convene, cultivate, create, and contribute. And let me explain: convene, cultivate, create, and contribute. By creating and contributing, what we mean is actively demonstrating, building new and demonstrating climate solutions actually right there on Governor's Island. That can be with individual buildings, it can be for the island as a whole, as well as developing new equitable climate solutions and training new workforces right there on the island, but also through networks involving partner campuses and the community. What about convening and cultivating? Well, that means bringing together the full complement of stakeholders, people in STEM, in universities, government labs, and the commercial sector. It means bringing together policymakers, decision makers in government at all levels, investors, journalists, and the public and students, K through 12, college, and beyond. But more than that, convening and cultivating also means understanding and serving as an ideas exchange for the excellent research that's going on globally. We don't have to invent everything ourselves. We will invent certain things ourselves, but we do have to disseminate everything that's important, and that will be a key role. And then using this convening function to bring together influential organizations and ensure that they learn about best current practices. Together, they identify and address technical gaps. They foster the translation of promising technologies. They demonstrate economic opportunities. They stimulate financial awareness, inform policymakers, and engage and educate consumers. In everything we do, matrixed across everything we think about, we have to insist on environmental justice as an essential element. So just to wrap up, Stony Brook University already has a lot to offer. We, as you know, have climate science and engineering strength. A lot of that is focused on coastal ecosystems and sustainability, which are key elements for the Governor's Island enterprise. We have lots of strength in important allied areas. We have renewable energy and energy storage. We have a program in public health, and we have the Alder Center for Communicating Science, for example. Then there's our longstanding commitment to accessibility and social mobility, hallmarks of Stony Brook University. We have our AAU status, being part of this elite group of 62 North American universities. We have our status as a public university, which seems to be a central theme in the requests for expressions of interest. And we also have the scale and maturity of our STEM research, and we have excellent research relationships in place, for example, with Brookhaven National Lab, who also are very serious actors in this area. And then, of course, we have our demonstrated ability to manage remote work sites. And I'm thinking here of the work that goes on at Stony Brook, Southampton in marine and atmospheric sciences. So as I said earlier, I think Stony Brook University has a great shot in securing the role of anchor institution for developing climate solutions at Governor's Island. That's the general idea. Rose, thanks again for your magnificent work. And I know that you and I would be happy to address any questions. Thanks very much.
Thanks, Paul. Rose?
Kevin, I just want to thank you for your willingness to support this initiative. You've been providing us with great feedback and guidance. And I know we actually have the whole proposal sitting in your hand right now. So thank you for your time. We so are grateful for that.
It's on my to-do list this afternoon. Rose, did you have anything else you wanted to add?
Not at all. I think Paul did a marvelous job. Thank you.
Got it. Rose, are you at liberty to at least share with the other council members some of the elite collaborators who will be participating with us yet, or is that confidential?
It's confidential, but I can trust this group, I'm sure. So let me share the great institutions that have agreed to partner with us as founding partners. We have the University of Oxford, we have the University of Washington, and Brookhaven National Labs are our founding partners, but we are fortunate to have many other, SUNY Maritime, Columbia University, Yale University, and a whole host of others that are kind of casting their lot to go with us, some non-exclusive. They may be putting in letters of support with others. And then a whole host of nonprofits, those that are currently engaged on Governor's Island and those that are not, environmental justice groups, workforce training initiatives across New York City. So just a great group of organizations that are all committed to working in this area and by helping to support scaling and integrating how we serve a greater proportion of New Yorkers and beyond.
Great. Well, that's exciting. And the point that Paul made before about being able to manage multiple, campuses or multiple operations, Do we have any presence left in New York City? I remember we used to have a small campus on Park Avenue. Is that completely gone? And if not, we should mention that. What's the status? Do we have anything left in New York City?
Oh, we closed that like 2 years ago.
What? Yeah.
We
But I
don't
thought-
have the, go ahead.
Go ahead. I thought we had some presence left.
We have operations. We have School of Social Work delivers education in New York City, and we have the arts communities. Southampton Arts from Stony Brook also reaches out and works in Manhattan, but I'm not sure we have any properties that we ourselves take care
But
of.
whatever, even if it's just our presence, we should highlight too, to show that we
Yes.
play in the city, did play in the city, we still play in the city somewhat. And Rose, if I didn't mention it on one of our calls last week, if we haven't already, we should try to get one of the CUNYs on our team of collaborators, because I think since this is a New York City initiative, I think they would probably want to see one of the CUNYs involved, whether it's the 4 years or any one of their community colleges. And if we haven't thought of that, maybe we could think about that.
Thanks, Kevin.
Great. Any council members have any questions for Paul or Rose? Nope, everybody likes it. It's exciting. And as Maury mentioned, it could be a real game changer. Just think about the Cornell Tech on Roosevelt Island. You know, that happened under Mayor Bloomberg's, administration. It's really been a game changer for the island and for the technology presence in the city. And similarly, something I always used to say when I was running LIPA, and that is our energy challenges, our economic development opportunities. And so in addition to doing the right thing by the planet, there are a lot of potential economic development opportunities and job creation opportunities. So it's exciting. It'd be great if Stony Brook was in the middle of it. So thanks, Paul and Rose. Our last item on the agenda is the revision to the Code of Student Responsibility. And Adam Furtman is here with us today to go over what we need to change and approve.
Thank you, Kevin. Good morning, everyone. I was not anticipating to see you all again at this point in the year, but here we are. It seems like we're averaging 2 times a year meetings related to this. All the council members should have received a memo and some edits that were sent late last week. Basically, the summary of it is a federal court issued a ruling on July 28th and then clarified it on August 10th, vacating a section of the 2020 amendments to the Title IX regulations. There has been recent communication from the Department of Education indicating that they will abide by this ruling and no longer enforce that section of the Title IX regulations that were issued in 2020, complying with the court ruling. In accordance with that, we have made a small modification to our Title IX grievance policy to ensure that we are also in acting in accordance with that. So if you've reviewed the Title IX grievance policy document, specifically pages 15 to 17, you'll see that there were a number of items struck through on that we are simply proposing to remove from that policy, as well as the Code of Student Responsibility. In sum and substance, it's related to a policy that was indicated in the 2020 regulations that stated if a party does not submit to cross-examination during a live hearing, any previous statements that they have made regarding the matter, whether to an investigator, to police, so on and so forth, could not be considered by the decision maker. What we are indicating now in the new policy is we are simply vacating that rule, which would then, by extension, allow previous statements made throughout the investigative process to be considered by the decision maker, whether or not the party submits to cross-examination and participates in the hearing. So we are asking for approval from the council for us to strike those sections to the policy and amend the code accordingly.
If I remember correctly, those sections were the subject of debate the last time.
It's been subject of significant debate here and everywhere
Fair.
for the last 18 months or so. So from on a practical standpoint, I can comment and say that I believe that this court ruling will allow for more people to feel comfortable sharing information in the investigative process and allow the university to follow up more significantly in these matters, rather than saying, well, if you don't show up for the hearing, we can't consider anything that you've shared with us at this point.
Right.
Which goes against sort of philosophically where we as a university stand.
Well,
So-
if the other council members are good, I'll move it.
Adam, this is about people other than the person being accused statements, not about the accused statements, right?
No, it's open for everyone, basically, that any
So-
statement. So it could be a complainant, it could be the respondent, and it could be witnesses.
So is the respondent then informed that when he's making these statements that they could be used?
During the investigative process, yeah, I mean, all information is shared up front as far as what the process looks like. And it will be published in the code, and all parties are advised by the investigators as far as, statements provided during this process can be used during the hearing process, for sure.
Because I didn't read, I mean, maybe I missed that in the code, that they would be informed that these statements could be used. Can you point that out to me?
I don't know that I can point it out directly in this section off the top of my head, but is Marjorie on the call? Marjorie, could you speak to the investigative process at all, and how the parties are informed of what
Good
their rights are?
morning. I can tell you that with the regulations that went into effect last year, part of the requirement is before we even close out the investigation, that we provide the parties, the complainant and respondent, with information and evidence that we collected. And evidence includes statements. So they have that information prior to the investigation formally closing and moving forward to a hearing. They will also have the investigative report 10 days before it gets to the hearing. So there are places in the process where they will be reviewing everything that has been made available to us and everything that would be presented at the hearing.
So that's not really what I'm asking. So I'm asking if the student who's being accused and who's being investigated is being told when he's talking to campus officials that their statements can be used against them, just similar to a Miranda warning. We've made this process overly legalistic, in my opinion. But if we're going to make it legalistic, we might as well make sure that their rights are protected. It appears to me that they would have less rights on campus than they would off, based on what I'm hearing.
When we interview the parties, regardless of whether it's the respondent or complainant, we do let them know. We have a whole spiel that we go through before they start talking about how we are not a confidential office. We do practice privacy, and that the information that they share with us goes towards the investigation, and that if it does result in a hearing, that information would come up in the report and at the hearing.
Okay, but so when I read the policy, I just didn't see it. Maybe I missed it. I've got a lot going on. But can you point out in the policy where that's actually stated as something we must do? So if we don't do it, the student has the ability to point to that?
Well, I know that by way of practice, our investigators do share that information. The policy that we have was what we took and adopted from our SUNY. SUNY developed the policy and we adopted it. However, we do have an internal practice where our investigators are giving that information verbally to the parties during the initial meeting.
So can we add a line to our policy that requires whoever's doing an investigation inform students that these statements can and will be used against them, just as similar to a Miranda warning?
Marjorie,
Is it
Marjorie,
always, is it against them though? Because I would think sometimes the statements would also help them, correct?
Sure, I'm sure it would go
I
both
mean-
ways, but I would think that more often than not, if you are the one being accused, anything you say can help, I mean, there's a reason why that law exists. They need to know that they could be expelled. There's other things that can happen, and their statements should probably be reflected. They are testifying against
hey,
themselves.
Marjorie and Adam, what Chris is asking for, can we codify the current practice in the policy? So it's not just a best practice that we carry out, it's now actually part of the policy that we're being asked to vote on. Is there any issue, Adam or Marjorie, if we codify the current practice?
Offhand, I don't see an issue with it. What I do want to do is I want to go back and make sure that it's not there somewhere throughout the many pages that talks about the new regulation. So I don't see a problem including it, but to answer the question, I would want to make sure that it's not already there. And if it is there, then we just need to make sure it's highlighted more. And if not, then we can look into incorporating it.
Yeah, I just didn't see it. I read it. I didn't read it as carefully as I did the last time we had this conversation. But I don't recall seeing it, so I could have missed it. So I'm sorry if I did.
Chris, I will add one comment. So in the regulations and in our policy, which does follow the regulations to a T, we are required to issue a notice of allegations to the responding party prior to them even coming in for a meeting, which lays out essentially what the allegations are against them or what has been reported to the university. So they are made aware of why they are coming in for a meeting or why their presence is being requested for a meeting at that time as well. In that section, it does not, we don't have, again, while I agree with you that this policy has been overly legalized by the Department of Education, I wouldn't want to call something a Miranda warning because it's we try and make this as educational a process as possible.
We don't have to say Miranda. We don't have to, Adam.
No, it doesn't have to be Miranda, but just give them some sort of notice that they are, that we're going to.
They do receive notification that they are under investigation and that there are allegations that have been made against them. I don't know if that satisfies exactly what you're looking for.
Father Alex?
No, I just simply said what Chris was saying, but it does mean that the person needs to know that whatever he does say or she says will be legally responsible for. So I think Chris is making a very valid point.
I agree also that, and it needs to be consistent that it's done every time, not just, by who happens to remember to do it. So codifying it, I think, is important and making sure that it's adhered to.
Adam, is there any reason why we have to approve this today? And can we approve it at the December meeting or on a quick council call that could take, a few minutes, sometime in the near future?
I would politely request that we could move to approve the section that of the regulations that we are looking to comply with, and then revisit the issue that Chris has brought to our attention.
Well, they're very direct. They're directly related, Adam. I mean, what we're saying is the students will come in for a meeting, which is now highly legalized. They can make a statement that's against their interest, and then we will expel them based on it. And they might not even know, and they probably won't know that they don't have to answer those questions.
Yeah, I think Chris is right.
I mean, it's to me, we've made this into a criminal process almost. It's a pseudo criminal process. I don't like it, but this is the direction the state's going in. I know it's not on you all doing it. So, I mean, if we're going to make it that process, we might as well make it the process and afford them the rights that other people who are accused have.
So just to remember, it is the process. And I understand what you're saying, that you want to put it in this as opposed to in our process and procedures. So it's not that we're changing what we actually do. It's that you want a line in this document. So
But if
Can we amend it
approve
right here?
contingent
Can we
upon
just?
What if we approve a contingent upon the addition? Does that help?
There's, can I just, oh, I'm sorry.
Margot?
I'm sorry. There's lots of language in here. Section K, through M and N about what's confidential versus private in the policy here. So
But
you
the
know, so
notice,
I'm just a little.
is there
sorry.
notice, Mayor? Like, Mayor, are you reading? Because I didn't see a place in there where they give notice to the student. I could be wrong. I could have missed it. You're a better lawyer than me.
No, I think there's language in here that, you could maybe add a line that says, but it's really difficult to navigate that because, it's even confusing sometimes if I'm reading it, but confidential reporting under section N, there's a whole list of people that you can report to that's confidential. So it's, I don't know how you change the policy without really digging into process. Or maybe it could just be sort of a precursor, to double, but I would imagine that on the forms that people are filling out when they're making these, assertions or filing these reports, there's got to be language there.
Adam, what court issued this ruling that we have to change our code for?
Sure, it was a federal court. I believe it was in the state of Massachusetts, and the clarifying document on August 10th clarified that it was going to be enforced nationwide, not simply within the federal jurisdiction of the court that it was.
Normally, that court wouldn't be, doesn't have jurisdiction over New York, and thus that decision is not binding on us. But if you're saying DOE is going to make this a nationwide policy based on this ruling, I get it. Can I suggest something that I think Linda was hinting at? If we need to get this going, I would move it as well, but on the condition that we direct Adam and Marjorie to quickly try to address our concerns by coming up with some language to address Chris's legitimate concern and suggestion, and that we amend this again, not just revisit it, but amend it, at our next meeting or sooner. And if the council is okay with that, then I would second Linda's motion to get this approved today, knowing that staff is going to address Chris's concerns in the immediate future.
Kevin, do you want to put a date on it, 30 days, 60 days? Because it sounds like Chris is, and I agree with it, you want to get this implemented sooner than later. So could we say 30 days or 45 days or some such number, and then we could come back for a quick meeting to approve?
But
Judy,
also,
when's our next meeting, Judy? In December?
December.
Our next meeting is in December, and I wouldn't have us wait until then. So if you want to, if you want to, I mean, we'll schedule something, frankly, this
Let's
week.
say 30.
I mean, this
Frank,
is
that's a good
E-
idea. Let's say
Evo?
30. Let's say 30 days. Let's try to get everything in place by November 1st. And if we have to do,
ask a question. Can we put this in to the mayor's point? Does this need to be in the policy, or could it be memorialized in the procedure and on the document?
If I might add, we can incorporate a line in the notice of allegations that go to the respondent that they receive before the meeting. So we can put that language in the notice of allegations. So when they are being notified that there's an investigation and they're notified what the allegations are, we could put language in that letter that they receive, letting them know about any information they provide us can be potentially used at a hearing if it gets to that level. That might be the quickest way.
I just think it needs to be in the policy. I mean, everything else is in the policy. Their rights need to be enshrined in the policy. We might have good intentions now, but the next team might not. So
Marjorie, let's do both. Marjorie, go ahead and do that. But we would like to approve it as an official policy as well, by November 1st. If we all have to get on a quick call with that as the only agenda item before the December meeting, we could do it. If everybody
Are
can't
we
make
not
it,
compliance with something if we don't approve this today?
Adam?
No, there's been no order issued that we have to comply with in a certain period of time. I think for us, we wanted to get this amended as soon as possible so that any students that might be going through the process understand sort of what is expected. And it might free up people that previously may not have wanted to file a complaint to feel comfortable in filing a complaint.
So it's beneficial to the student.
I believe so, yes.
That's what, that was my take on it as well.
All right, we have a motion and a second to approve this conditioned upon staff revising the policy for an additional action by this council by November 1st. Anybody have any comments or questions on that motion? Does anybody have any no votes on that motion? All right, the motion is approved. Adam,
Thank you very much.
do you need us to do anything else today with the student code of conduct?
No, that was it.
You know what? Correct me if I'm wrong, Adam. You know, I'm looking for it. I can't see it now, but on the materials that I was reviewing over the weekend for the meeting, I thought there was some type of new change we had to do to the language in the code of conduct based on the recent decriminalization of marijuana in the state. Did we get
No.
something on that, or you know,
Not for me.
Judy, did we see anything? Where was I reading that? Yeah.
Yeah. We don't, and in fact, you know, there's not a perfect match between state and federal laws on this issue, so our policy remains.
Yeah, I thought I saw a chart showing the distinction between state and federal law, and because Stony Brook gets federal funds, the state law didn't necessarily apply, and federal, it's still criminal activity at the federal level.
Didn't we talk about this last month, the last meeting, and we said that there was certain school policies that we were.
Was it in the minutes then that I read from the?
Yeah, I think it was the minutes, Kevin. Yeah.
I don't dream these things.
We did discuss it during our May meeting and indicated, in fact, that we are required to follow federal law as it regard to cannabis and marijuana related products. So no, we're not proposing any edits at this time related to that.
Which means, in essence, our existing policy remains the same.
Correct.
We don't need to make a change, even though state law has changed. Not just we don't need to, we really.
We
Yeah,
can't.
so yes, it's in the minutes on page 8. It said draft not yet approved by the council. So that's why I was wondering, at least on what I got. I thought we had to make some type of approval on this. Was this language just a reference that the minutes were not yet approved by the council?
Exactly. Yes.
So we did already make these changes. Guys, I knew I wasn't making it up. But now just somebody refresh my recollection. So while pot is decriminalized in New York, kids on campus can still get busted for a possession based on federal law. That's the rule.
Yes.
So they can go off campus and have an ounce of pot and smoke joints and not get in trouble, but they come on campus, they can get in trouble.
That is correct. They still would be in violation of university policy if they were in possession or in use of marijuana or cannabis-based products on our campus.
And is it just students, or what about staff? Are staff allowed to possess pot on campus, or is it just students?
I only deal with student violations of the code of conduct, so I would not be able to comment on faculty or staff use of cannabis products.
How about Larry? Any thoughts on that? Students aren't allowed to have pot on campus, but staff and faculty and visitors can?
Staff, faculty, and visitors are subject to the same, the enforcement and the application of the penal law, but it does not preclude them from also being referred to labor relations, which may or may not be moved on. So it's really the same. The standards are different for the students, but we'll use the term decriminalized loosely. But there's still requirements to the workplace. So people who drive, people who would not be able to be impaired for their for their job could be subjected to labor relations, et cetera.
Got it. All right, well, thanks. Interesting issues.
Indeed.
So that, finishes our regular agenda. Does any council member have any other items they wish to raise? There are none. Maury, do you have anything else you'd like to add?
No, I believe we've covered
All right.
wide range of topics,
Yes, we did.
from vaccine
oh.
mandates to marijuana policy.
Well, it does. Well, so our next meeting is December 6th. Rachel and Judy will send out the information dependent upon the Delta variant and how things are going. Hopefully, we'll determine if the meeting will be in person or not. But until then, thank you very much for your participation. And Father Alex makes a motion to adjourn, and Frank seconds it. All in favor?
Aye.
Thank you, Maury. We'll see you guys soon. Thank you, everybody, for your participation in the meeting.